Alberta's doing it, hiking the minimum wage to $15 an hour, and labor groups want the Ontario government to do the same thing. Our Queen's Park reporter Mike Crawley is on this story for us tonight. Mike, let's explain why the campaigners want to see a higher minimum wage.
Well, because they say it is very difficult to get by on the current minimum wage, given the cost of living, especially in places like Toronto. But they also say that a higher minimum wage would actually be good for the economy because people would spend that extra money that they earn rather than save it. Now, right now in Ontario, the minimum wage is $11.40 an hour. About 500,000 people in the province make that. But if the minimum wage does increase to $15 an hour, that would mean about 1.5 million people would get a raise. Now, the NDP has already endorsed this idea. They say that if they form government after the election in June of next year, that they would bring in a $15 an hour minimum wage in Ontario. Dwight?
All right, so Mike, what about the people who have the power to make that change, the Liberal government? Are they open to raising the minimum wage?
Well, right now, they're sounding pretty lukewarm about it. They promise that, what they're doing with the minimum wage is to raise it by the rate of inflation. They've brought in a law, in fact, to do that, and the Premier says that's enough.
We came up with a system that actually depoliticizes the increases to the minimum wage. And so we see the minimum wage going up according to cost of living index. And that means that we don't have that debate in Ontario every single year. And so I think that is the responsible way to move forward.
However, there are some sources in the Liberals that are telling me that the party wants to hang on to this idea of a $15 an hour minimum wage and make it a campaign promise in the election next year. And the reason is that would cut into NDP support, which is something the Liberals need to do if they want to win that election. Dwight?
All right, thank you, Mike. Some doctors pushing for a higher minimum wage are part of a group called Health Providers Against Poverty. They say the current wage is forcing people to make some tough choices, and they're seeing that in the emergency rooms. One of those doctors, Kate Heyman, will share her experiences with us in about 20 minutes. There are more calls tonight for Ontario to boost its minimum wage. Right now, it's $11.40 an hour. But as we told you earlier in the show, some labor groups want to see it raised to $15 an hour. The idea of following in Alberta's footsteps and raising the minimum wage was put to Kathleen Wynne today. The Premier, though, is lukewarm on the idea, noting the Liberals brought in a law that raises the minimum wage by the rate of inflation. A group of doctors called Health Providers Against Poverty say there is a link between earning minimum wage and your health, and I spoke to one of those doctors earlier today. Doc, let's talk about the health effects of low wages on the people you see.
Yeah, so I mean, poverty affects a ton of the patients that I see, and it probably has a bigger health impact than almost anything I do for them, frankly. Particularly in the emergency room, I see a lot of people who can't manage their chronic disease because they just can't afford to. So they can't afford to take time off work to go to doctor's appointments or get preventative health care. They oftentimes can't afford the medications or physiotherapy that's prescribed to them. And they have mental health effects of being poor, of being employed in multiple jobs, not being able to look after their kids. It's really frustrating. So
what happens if you prescribe a medication and I can't afford it, or the person you're trying to help can't afford it? What do they do in that situation?
They usually just get sicker. In the emergency department, it's not like we have samples that we can give to patients. So for example, if someone has a pneumonia and I prescribe them antibiotics and they can't afford the, say, $30 for the prescription plus the time they had to take off work because they were sick, they could get a lot sicker, and sometimes they do. And
we can guess the kind of jobs that they are working at, there is no health plan with those jobs.
Yeah, for many, many low-income workers, they're precariously employed and they have no health benefits. So no prescription drug coverage, no access to physiotherapy, they have no paid sick leave, and in some cases they can actually even be fired for taking a single day off of work.
So talk about then the kind of difference that a $15 minimum wage would make in the lives and ultimately the health of these people?
I think it would make a tremendous difference. It would mean for a lot of my patients, you know, for example, getting sick wouldn't be a disaster. It might mean that they didn't have to make the decision between taking a day off work without pay to get better and continuing to work through an illness like the flu. It would mean they could fill the prescriptions, they can afford the TTC to get to their appointments. Maybe they can afford to go to appointments with their kids, which means they get vaccinated at higher rates, for example. I'm in a really privileged position to be able to recognize what a tremendous impact this policy has on people in Ontario. But honestly, I think this potentially could have a bigger public health impact, raising the minimum wage, than almost anything else this government is doing.
As a physician, when you are seeing these people and you're trying to help them, what does that do to you, knowing that you can't help and a $15 minimum wage, in your opinion, would mitigate these things?
Oh my gosh, it's so frustrating. You know, I have 9 years of medical training, and at the end of the day, I have patients where all I want to do is prescribe more income. And really, my hands are absolutely tied, and I need policymakers and the public to recognize that more income, a higher minimum wage, would have such a tremendous impact in people's lives and a bigger health impact than, for example, almost anything I'm going to do in the ER later tonight.
Thank you, Dr. Heyman.
You're welcome.